In this video, we're going to show you how to use practice search and the view column options to create a search that can present you with a great deal of data to look for patients that might be complex or have metabolic syndrome. So let's start at practice search. And to begin the practice search, use a basic search. We're going to title this called Metabolic Syndrome View. And I'm going to search the database. And you may begin by searching for a individual providers panel. You might look at only patients that have been verified as in the practice, and you may use status appropriately as you've been using it to define paneled patients in your practice. In my example, I'm going to take this out because it will show more data in this demo database. So I'm going to start with a basic clinical search. If I'm looking for patients with metabolic syndrome, I'm going to look for any patient that has had a lab result and a hemoglobin A1C is my base criteria. So these patients have had a hemoglobin A1C, and we're going to use a basic value of 5.8. Your clinicians may have a different value, and you will use observed in the last time frame as appropriately for your clinic. I'm not including it again because I'm using a demo database. When I view the results as a patient list, you'll see that you get in your data the list of the patients, their sex and age, and we get a hemoglobin A1C and a date for that hemoglobin A1C. What we're going to do is we're going to add some columns to our data so that we can have more information to inform our decision making and identify patients that may have metabolic syndrome. So in this case, I'm going to go to View, Column Options, and you can see that I've created some views in my database, but you may not have these in your Wolf EMR. To create a new one, you're going to click Add. This is a one-time process, by the way. And once you do this, you can create any list and then use the metabolic syndrome view to potentially identify patients that may have metabolic syndrome. So you can see the view has no columns that have been added. I'm going to include the automatic columns based on search because I've already included hemoglobin A1C. What I'm going to add is I'm going to add the last visit date. It's always important to understand when patients have or have not been in the clinic at all because that may itself put them at risk. The next criteria that I'm going to add is a lab result. So I'm going to choose lab result, most recent of type. And since I started with hemoglobin A1C, I'm going to hit the F key, and that puts me down in the F area, the lab results. I'm going to choose fasting glucose. You also see that there's a star beside my fasting glucose. It means that somebody in the clinic has done lab code merging to ensure that all the fasting glucose results are merged under one lab code. There's a good video that's on the top website that describes how to do that. So I've included the last fasting glucose result. I'm going to add to that the date that last fasting glucose was done. So I'm going to hit F again, and I scroll down till I hit fasting glucose, and then the date for that result has been added. The next one I'm going to add are some lipid parameters. So I'm going to add the last result for cholesterol. I hit the C key. I find myself in these lab values, and I'm going to choose cholesterol. Again, this one has had lab code merging done to it, and I need the date for that cholesterol. So this is a little tedious, but as I mentioned, you only need to do this once. And once you have done it, you can use the view over and over again, and you can choose all kinds of clinical criteria to make your views. The next one I'm going to add is triglycerides. And that is a lab result. I'm hitting the T key, and I choose triglycerides. And I need a date for that triglyceride data. The next value I'm going to add is BMI. So BMI is not a lab result, but you will find it in the exam findings values. Here we go, exam findings, most recent of type. And here I'm going to hit the B key until I see BMI. And I will include the BMI and the date that that BMI was done. And again, you have to scroll down to exam finding values, date of most recent type. And I'm going to select BMI and hit OK. And then the last piece of data that I want to add is the blood pressure. And that too is an exam finding value. Or you can actually, it's actually there. It's blood pressure most recent. I can just select that, and I can select the date of the most recent blood pressure, and I hit OK. So I've added a great deal of clinical data to my search view columns. If you don't like the order that it appears, you can just click on the value and use the move up, move down column button to rearrange it. So once I hit OK, it's going to search the database and pull in all those columns. In your real database, this might take a little bit, a few seconds, because it's pulling in a great deal of data. So once the data has been pulled in, you're going to have a new view. Wow, this pulls in a whole lot of useful information. So the important thing that you can do at this point is you can sort the data. Let's say I want to sort and view the data with the patients with the highest hemoglobin A1C at the top. And a clinician, a nurse, or someone with a clinical background can view across, and they might think, gee, I think this patient and this patient may have metabolic syndrome, so I'm clicking them off. And you've sorted by hemoglobin A1C. You might want to sort the data from blood pressure, again, the highest value at the top, viewing the data, and you may select the patients you want to consider that may have metabolic syndrome. Again, and you would do this for each of those clinical values, viewing the data with a clinical eye to say, I want to investigate these patients more to see if they have metabolic syndrome. So what can I do next? Some of my options are I can simply print the list, or I can print the list including only those patients that I just clicked off. The other action is I could export this list as a CSV file and keep an electronic copy if we use an electronic copy in the clinic. The other action that I could take is any patient that I did click off, I could add to a follow-up. And so I could create a follow-up here. I could create it just for myself. And I would write in here, consider follow-up for metabolic syndrome, and that will create a new list in my follow-ups. The other action I could take at this time could be that I create a new patient list. So this is a relatively new feature of Wolf EMR. And you can use a patient list if you're creating a course. Let's say you have a diabetes clinic coming up and you want to manage the invitees for that. It's another place that you can keep lists in the EMR, but maybe you're going to invite a group of patients in for a group visit. You could consider that. In which case, all those patients that you selected and have a tick mark beside their name, you could add to a new list, and you could create a new list if you wanted to called metabolic syndrome. So in summary, this is a feature where you can do a single simple practice search. In our case, we were looking for anybody with a hemoglobin A1C over a given value, and then adding columns to view, in which case we can sort by all the column headers, and we can look at the last visit date for those patients and see which patients may require some follow-up. One other column we didn't add, but we could add here is another view in columns, is that you could add the next visit date. So it is one that we could add to our view, and I know it's down here. There it is, next visit date. The other item or criteria you may want to add to your view is the date of verification. That would also say that's the last time that anyone verified both the demographic data and the attachment to a primary provider. So I hope you find this feature useful. Thank you very much.